traditional means of intervention. Some selected objectives. Again, this is a repetition. Objectives of the Teso Health Forum. 1, we seek an empowered community, one that is informed, engaged, and practicing in health promotion activities, including health education, school health. Judith did for her thesis, school health in Tororo County. She went around the school in Tororo County, looking at the compound, the latrines, water, and so on. And she had her small write-up. I hope one day she will share it with us. Because school health, school children can be the ambassadors of health messages to their families. And health professional regulation. And what I mean here, especially from my background, is that when the community meets challenges, when they go to institutions, and there are people there who cause them to want to go through the roof, either because they are asking for kitu kidogo, or they are immoral, or they are abusing them, they ought to know where to go, where to report, and get attention. They ought to know who is a false, who is a quack, and not be there's a better word, but they ought not to be deceived and taken advantage of because they are ignorant, going to anybody who in a white coat. Empowered health service. We need an adequately trained, qualified, competent, well-paid, and motivated health professional workforce. This has already been said. And adequately structured, supplied, and manned health institutions, including training, research, public health, and care. And as Papa said, access to quality health care. We should have the services available and affordable. We have dreams, not only of having an institution like this one, but maybe 10 more, and maybe 10 times bigger in Teso, because we have the human resource capacity, if we can only get the inputs. But we don't want our people to be onlookers while planes flying and have children of Indians having their hearts operated and ours. We also need to find a way of ours having access to this first-class healthcare. Some areas of focus. Again, these have been mentioned. As I said, community empowerment and engagement. We need to have, these are low-lying fruits, talking to our people, educating them, radio programs, and so on. MCH, I only put school health in bold because I'm putting it as something new that has been neglected. Training and internship, and again internship, because we have institutions in our region with the potential to have internship training, like Frida Kahlo. But what is missing? The main thing that is missing is just 2 people called full-time surgeon and maybe a physician. We already have a pediatrician and an obs and gynecologist. And internship maybe brings 10 doctors to work and give our people a better service. This is something that is easily reachable and attainable. Specialist training and practice, we have people all over the world. In our interactions on the forum, some in Nairobi, some are doing neurosurgery, some, when they have done and they have acquired their skills, they ought to be able to come. If not just do locum, they can come and be here. specialist care referral institutions and destinations. Last time when some of you who attended the burial of Dr. Apollo, our politicians spoke, and I hope that what they were telling us is something that is concrete, and that's something that has been solidified. One, that they have requested or demanded from government that we have an ultra-modern specialist hospital in Soroti, and that 19 acres of land in what is the place? Arapai has already been identified. That was number one. Number two, that we have a blood bank. Number three, that the Soroti hospital, the one there now, be refurbished. Now, if that is true, and if that's going to be the manpower, where is it coming from? It's going to be us. To the extent that maybe if the Indians will come, they will come and operate from here and go back, but not us sending ours to be operated from there. Private initiatives, this is an understatement. My brother was saying entrepreneurship. Times people get scared, but let people who have money, who think they can tap in and fill in the gaps, come. Of course, with a healthy attitude, not the one that is completely reckless, but one that is, if you want to serve, in the process you'll get something, but you'll get some fruit, but above all you'll get honor. And if you're a believer, you know that you'll have the true reward from the Lord himself. Community health insurance is something that is coming, and we ought to be maybe the first to have something successful, something that works in the community, to help our own access quality health services. We all say something on strategies, strategic principles, and this is almost stating, strengthening what is there, as performers was saying. Making the best of what we have. There is no need creating wheels. There are many, many institutions and infrastructure on the ground that is not properly utilized, that is left to waste. We identify, we make the best of those institutions. We are here. We could have been in a hotel, but we are making the best of what is there, of what our brother has put in place. When you come to Tororo, maybe I'll just take you to a senior primary school rather than taking you to the Rock Hotel. They have a good hall. You meet, and you'll also be able to see Kwapa. Tororo you have seen, and you'll see many times. Other resources, tapped and untapped, they are there. We have a lot of whole forms of gold in all sorts of forms. We just need to look enough. Then, strategic principle number 2 is partnerships. Partnerships. We are not going to do it alone. We are not going to be alone. Our partners are going to be government, civic organizations, or civil society organizations. Our leaders, our parliamentarians can be very, very instrumental. Let us not be antagonistic with them. Let us see how we can communicate and sell our vision and our agenda to them. In the end, they will realize, oh, but these are people who are doing exactly what I'm in Parliament for, and we should be partners, hopefully. NGOs, including many Teso-oriented organizations. This is what Papa said. There are many, many fora, and we go with those who will act and help us achieve what we want. Then, issue. Now, I just want to say a little bit more on our relationship or tapping through issue. I think Papa Maswa has already outlined it. Now, I got quite a number of congratulatory messages when I was appointed Minister of Health. Some were from colleagues in London, South Africa, in Nairobi, with all sorts of messages. They are beautiful reading. But two of them were people who are members of the Buganda Kingdom Health Board. And they all promised to share with me how they will be working. But Papa, I should have asked you this topic, whether already we have a Teso Health Board that would be under you. But you know, boards would normally be under the minister. Members of the boards are normally probably